Hey folks, this is One-on-One. I want to introduce you to Dr. Karl Strom, who is Medical Director, Center for Bariatrics at the Southern Ocean Medical Center, a member of Meridian Health. Good to see you, Doctor.
Thank you for having me today, Steve.
Bariatric surgery, what is it?
Bariatric surgery is basically for patients that are severely overweight, usually BMIs of 40, which is about 100 pounds.
BMI?
Body mass index. It's a calculation that includes your weight and your height, usually about 100 pounds over your ideal body weight. And this is an individual that's been struggling their whole life with this issue. And it basically accomplishes their weight loss. So not only will we maintain their weight, but we're going to maintain it for years to come.
Okay, now bariatric surgery, we're about to see a piece of video in just a moment, but bariatric surgery includes the lap band surgery, the sleeve, and gastric bypass, right? Three different forms. What is lap band?
Lap band is a purely restrictive procedure. Basically, it's a collar placed around the upper portion of the stomach to form a new stomach above it. Your new stomach is approximately half the size of your fist. So as you eat less food and you feel full. As you lose about 1 pound to 3 pounds a week, 50% of your excess body fat's lost in the first year. That's if you stay compliant with us, the dietitian, exercise, and support groups. Now you're going to lose the weight, but you maintain it for years. Now as they start losing weight, Steve, that funnel opening gets a little bigger. The food goes through a little faster and the weight loss slows down a little bit. So we have a little catheter that we attach to a port. We place the port underneath your skin.
Move that down. Steve just grabbed that, our cameraman. That's the catheter?
Yes, right here.
Talk about that.
The port right here is located underneath your skin. You can't see it, but if you press down deep, you could feel it. That allows us to access this in the office. We add a little fluid, the funnel opening gets smaller again, you stay full, and you continue to lose weight. The nice thing about the band continues compared to a normal diet is, when you go on a normal diet, you change the types of foods that you eat, but you don't change the size of the stomach. So when they eat these smaller portions, they don't feel full. When we do this with the band, with this restriction, we create this new stomach. When this new stomach stretches, it relays to the brain that you're full. So now, not only are you changing the types of foods, but also the quantity and the calories that you intake every day.
That's the lap band.
That's the lap band.
Before we do the sleeve and gastric bypass, can we
Yes.
take a look at this piece
Sure.
of video? Because I believe this is a couple, and the couple both had the lap band procedure?
Correct.
Let's take a look at the video, and then we'll move on to the sleeve and gastric bypass. Let's take a look at the video.
I had the surgery, the bariatric surgery first because my health was just very poor. I was steps away from high blood pressure, stroke, heart attack, and it needed to be done or else I would be going on 30 and unable to fulfill my life. Surgery went very well, no complications at all, and the effects were all positive. I have more self-esteem, more confidence, I'm able to move better, I can do a lot more things I wasn't able to do when I was very overweight.
With me, I've lost 90 pounds in the last 9 months, and everything's interesting. You gotta buy new shoes, buy new clothes every season that turns around. The small things like getting my wedding bands resized, and everything's just different and better, and it's more exciting.
Interesting. Now, the total amount of weight, go through it again. He lost
over 100 pounds, and she lost about 80 pounds at the time of this clip.
And they were the right candidates for that?
Correct.
What impact does it have on the, no other way to say it, quality of their lives?
As you could see, it's significant a change in their life. We see this day in and day out. He had hypertension, other people have diabetes. All these resolution of these comorbidities occur after this surgery.
What's the sleeve?
The sleeve is something a little bit different than the band. It's completely restrictive procedure, but there is no...
What does that mean, completely restrictive?
Well, as we're going to go on later on with the bypass uses malabsorption and restriction. This uses restriction only, okay? In other words, we don't change the anatomy at all, the lower anatomy, as far as malabsorptive procedures to help lose the weight. So in restriction with the sleeve is, we don't put a foreign object in, but we do divide the stomach to make a very long, narrow column. It looks like the shape of a banana. Same size as the new stomach as with the band, half the size of your fist. So as these individuals eat, they eat less food.
You change the size of the stomach?
Correct.
And how's that different from gastric bypass?
Bypass, not only do we change the size of the stomach, but we change the lower anatomy so there's malabsorption that occurs.
What is that malabsorption?
As food travels down the first portion of the small bowel, the intestinal tract, no calories are absorbed. So it's not absorbed. That's malabsorption.
Dr. Strom, let me ask you, are the people who come to you say, I've been trying to lose weight for years, this is it, every diet in the world, I want this, and you say, nah, not you?
Have we ever said no? There's a long process. It's not just somebody comes to the door and says, I want a lap band,
Right.
bring me to surgery tomorrow. It's a complex system. First of all, they go through a psychiatric evaluation, a nutrition evaluation, and also our consult to make sure that these are truly individuals that are candidates for surgery.
So that's a really important process, the screening process, the evaluation process, the psychiatric part, all those issues, the mental health part.
Correct. We're a center of excellence, which is unique. By the American Society of Bariatrics, there's only about 6 or 7 other hospitals in New Jersey that achieve this, and less than a couple hundred surgeons in the U.S. And that provides the framework so not only these individuals lose the weight, they're going to maintain it in a safe way.
But there are some people out there right now watching who have tried a lot of different procedures, who are in fact candidates for this. And listen, we're not advocating, not going to push, that's not what we're here to do. But is there a party that says, I wish someone would in fact come and talk to us about this because you know that they're a candidate?
Yeah. Yes, first of all our patients have tried multiple diets. They seesaw back and forth. What is unique about this type of surgery, it's like the policeman or the speed bump. It helps them. Once they lose the weight, they don't seesaw back and forth. Because like I said earlier, what happens on normal diets, you lose the weight, you might lose a significant amount of weight, but you fall off the diet because that stomach is still large and you start to eat a little bit more and graze and you gain that weight back. And in order to lose all these complications such as sleep apnea and diabetes and hypertension, you need to maintain the weight loss.
This is no quick fix.
It's no quick fix.
Clarify that.
This isn't the easy way out. Afterwards, there's a lot that goes into this. There's follow-up with us. There's exercise programs. There's behavioral, actually we have support groups that are available for our patients that are led by a dietitian and behavioral specialist. So there's a very complex and dedicated patient to succeed in this.
How many procedures do you think you have performed? Why are you smiling when I ask that?
Because everybody always, that's one of the common questions a patient will ask me. I performed over 5,000 of these procedures.
5,000?
Yes.
On a regular basis, on a week, do you do more now, or is it more, I don't want to say popular, is it more prevalent now?
Well, right now, actually, in the last few years, it's more acceptable by all the insurance companies because they know the effects on their patients and it's the wellness of how their patients become. Right now, we do about over 20 a week for these patients.
Interesting. Dr. Karl Strom, Medical Director, Center for Bariatrics, Southern Ocean Medical Center, a member of Meridian Health. I want to thank you for educating us, helping us better understand a very important issue having to do with weight loss surgery, bariatric surgery, and no quick fix. Thank you, doctor. Appreciate it. Stay tuned. We'll be right back right after this.